Everyone, today we'll be studying about the retainers, so let's begin. The retainers are the passive orthodontic appliance, that is, it does not exert any pressure. It is a passive appliance that helps in maintaining and stabilizing the position of the teeth long enough to permit the reorganization of the supporting structures after the active phase of the orthodontic therapy. So as long as it permits the reorganization of supporting structures like the principal fibers, the gingival fibers, and the bones like the osteoid bones. So for that, okay, so now there have been the criteria for the good retainers, that are the retainer should retain all the teeth that has been moved into the desired position. The retainer should permit the normal functional forces to act freely on the dentition. It should be self-cleansing and should permit the oral hygiene maintenance, and should be an inconspicuous aspect, which means it should be unnoticeable. It should not grab the attention. Okay, so now let's talk about the retainers. They are the removable retainers and the fixed retainers. So first we'll talk about the removable retainers. The removable retainers, they are the passive appliance that can be removed by the patient and reinserted at will. Therefore, the patient compliance is very important for the success of this appliance. Hawley's appliance. The Hawley's appliance was designed in the year 1920 by the Charles Hawley. It is the most frequently used retainer. The classic Hawley retainer consists of the clasp on the molars and short labial bow extending from the canine to canine, having the adjustment loops. The simple design can be modified in the several ways to suit the specific requirements. The labial bow can be made to extend from the first premolar to the opposite first premolar. This design helps in closing the spaces distal to the canine. It helps to close the space that is distal to the canine. Another modification is to solder the bow to the bridge of the Adams glass. This design avoids the risk of the space opening up between the canine and premolar due to the crossover wires. Now the next is the fitted labial bow, which can also be used to offer the excellent retention. The anterior bite planes can be incorporated to retain or correct the deep bite cases. The advantages of this appliance include ease of fabrication due to the simple design and minimal patient discomfort due to reduced bulk. In addition, it is acceptable to most patients as it is relatively inconspicuous, that is unnoticeable. Now next is Beck's retainer. The retainer was popularized by P.R. Beck. It consists of the labial wire that extends till the last erupted molars and curves around it to get embedded in the acrylic that spans the palate. The advantage of this retainer is there is no crossover wire between the canine and premolar, thereby eliminating the risk of space opening up. The next is clip-on retainer or the spring aligner. This is the picture. The appliance is made up of the wire framework that runs labially over the incisors and then passes between the canine and premolar. Then it is running here and then it passes the canine and premolar and recurved to lie over the lingual surface. Both the labial as well as the lingual wire segments are embedded in a strip of the clear acrylic. As we can see here, this wire framework inside the clear acrylic. This is the labial, this is the labial and lingual inside the acrylic. Now the retainers can be used to bring about the correction of the rotation commonly seen in the lower anterior region. Now the next is a wrap around retainer. This is extended version of the spring aligner that covers all the teeth. As we know, the spring aligner covered only the anterior. This covers all the teeth. It consists of a wire that passes along the labial as well as the lingual surfaces of all the erupted teeth, which is embedded in the strip of the acrylic. First, there is wire framework in the labial as well as lingual surface. Now that wire framework is embedded into the strip of acrylic. It finds the application in the stabilizing the periodontally weak dentition. The use is in the condition where the periodontally weak dentition is present. Now next is the Kesling tooth positioner. The tooth positioner was described by H.D. Kesling in the year 1945. Here we can see the Kesling's tooth positioner. It is made up of the thermoplastic rubber-like material that spans the interocclusal space and covers the clinical crown of the upper and the lower teeth and the small portion of the gingiva as well. The tooth positioner needs no activation at the regular intervals and is durable. The drawback includes include the difficulty in the speech and risk of TLJ problems. Now, the next is invisible retainers. They are retainers that fully cover the clinical crowns and a part of the gingival tissue. It is also called the A6 retainer. They are made up of the ultra-thin transparent thermoplastic sheets using a thermoforming machine. Now, this is the picture here. Invisible retainers. This is the process of making it. They are aesthetic and often go unnoticed. The advantage is it has minimal bulk and therefore does not interfere with the speech. They are also devoid of unaesthetic metal components. They are quick to fabricate and relatively inexpensive. The clear retainers are usually given for the 6 anterior teeth. However, if the treatment involves the extraction of the first premolar, they should be extended up to the distal of the second premolar. In case the second premolar extraction, they should be extended up to the distal of the first molar. The next is fixed retainers. These retainers are fixed or fitted onto the teeth and cannot be removed and reinserted by the patient. Now the fixed retainers are band canine to canine retainers. So this is the picture of banded canine to canine retainers. Here, this type of retainer is commonly used in the lower anterior region. The canine are banded and a thick wire is contoured over the lingual aspect and soldered at the canine bands. Here, canine is banded and the lingual wire is here. It is soldered. Now, the bands predispose to the poor oral hygiene and are unaesthetic. In addition, when these retainers are removed, the band spaces are seen around the bands. And because of this disadvantage, it is less popular than the bonded retainer. The next is the bonded canine to canine retainers. Bonded, here bonding is done, canine to canine retainers. So they are the bonded canine to canine retainers are the retainers that are bonded on the lingual aspect. The stainless steel or the blue alloy wire is adapted lingually to follow the anterior curvature. The ends are curved over the canines where it is bonded. The disadvantage of the design is that the anterior teeth can sometimes rotate. This is overcome by using the bonded retainers that are bonded on each of the anterior teeth from canine to canine. In case the extraction has been done as part of the orthodontic treatment, it may be advisable to extend the retainers to include the first premolars of the both sides. Various prefabricated lingual retainers are available that can be bonded onto the teeth. An alternative to the use of the wire is to use the etched or perforated metal cast bars that can be bonded on the lingual side of the teeth. Recently, some workers have recommended the use of the braided or the multi-strained wires that can be bonded individually to each tooth in a segment. The advantage of this kind of the retainers is that all the individual teeth are retained with no possibility of rotation of the incisor. In addition, the use of the lighter braided wires permit the physiologic movement of the teeth within the periodontal ligament. The drawback of this retainer is difficulty in maintaining the oral hygiene. The bonded fixed retainers are mostly used in the mandibular arc. Their use in the maxillary arc is mostly to retain the midline diastema as shown earlier. They can interfere with the occlusion when we are using it for the maxillary arc. Is the perforated bonded canine to canine retainers that is bonded only onto the canine. B is the bonded canine to canine retainers made up of the soft braided wires that is bonded on each of the tooth. And C is the bonded retainer in the maxillary arc between the two central incisors to retain the midline diastema. Next is band and the spur retainer. This type of the retainer is used in the case where the single tooth has been orthodontically treated by the rotation correction or the labiolingual displacement. The tooth that has been moved is banded and spur as soldered onto the bands. Fiber composite retainers. The fiber reinforced composites FRCs are made up of the glass fiber enclosed in the composite resin. They are available as the stripes of 0.12 mm thickness and 1.124 mm in width. These are slowly gaining the acceptance as an aesthetic fixed form of the orthodontic retainers. These retainers are used in the patient with the allergy to the metals or with the high aesthetic demands. These retainers are bonded on the lingual surfaces of the teeth similar to the metal